In this lecture, we're going to talk about learning and performance assessment now that we've talked about developing goals and objectives for learning activities. So the purpose of a learning assessment is that it's an objective standard of performance. It's a good self-assessment for the instructors. So from the instructor's perspective, testing is useful to help make objective decisions concerning the competency of the learner in the clinical laboratory. And in competency assessment for laboratory personnel, testing is one mechanism to document that the individual possesses the necessary knowledge, skills, and attitudes required to perform laboratory procedures. And also, it's an advantage for the instructor because it evaluates the effectiveness of their instruction and curriculum, and it helps identify subject areas where the majority of the learners perform poorly and gives the instructor opportunity after the presentation of the material to make it more effective and do some remedial instruction to make sure that those objectives have been mastered. From the learner's perspective, learning assessment is useful for assessing strengths and weaknesses and improving problem areas as the course progresses because they can definitively see where they're having problems. It also motivates the learner to study the material, and it can act as motivation for competitive learners who want to do better than everyone else. So there are different types of learning assessments. So in terms of tests, there's placement tests where you assess the prerequisite skills and knowledge. This is before you've had a learning activity just to kind of see where people are at. This would be like a pre-test or to see what kind of class you need to place them in based on their level at the time. And then you have formative tests, which are designed to assess knowledge during a course. And these are designed to cover a limited amount of information. So this would be things like a quiz or a unit exam. So they're not everything. Whereas a summative test assesses mastery of the instructional material. And these are like cumulative exams. This would be like your cumulative final exam for a course or something like the Board of Certification exam for CLS students. So there's different types of testing platforms. The one that you're probably most familiar with is a written exam where you have where you write everything out on paper. You also have oral exams, and that's helpful in the laboratory to question individual learners in order to develop their problem-solving abilities. You also have computerized exams, and these can be both adaptive or non-adaptive. Adaptive you'll often see in the Board of Certification exam because the better you do, the harder the questions get, whereas the worse you do, the easier the questions get, and it helps fine-tune where the learner actually is in their competency. Whereas non-adaptive exams are much more like the written exams where everyone's going to get pretty much the same questions, and it's not going to get harder or easier based on how you're doing. It's just these are the questions. Have you met competency or not? And then there are practical exams. These are developed by combining the performance of a laboratory procedure with the response to written questions. So the practical exams are able to assess both psychomotor and cognitive skills. And this type of test format is very useful in evaluating learner performance and is more accurate than using written tests alone to assess the learner's ability to function effectively in the clinical lab, because the clinical lab isn't just book knowledge, it's actual psychomotor skills. So a practical exam is great for testing that level area of competency. So there's different types of tests. There's norm referenced and criterion referenced test. A norm referenced test is where the achievement is based on the performance of others. So this is like where you're being graded on a curve, and it doesn't really assess competency. So a norm reference test represents like the traditional achievement tests where the learners are evaluated against one another on test performance. So for a test, an 80% score on a norm reference test might be an A if everyone in the class performed at a level below an 80%, or on a different test, an 80% might be a C if the mean for the test was 85%. So some learners don't like this because if they're a overachiever, then, well, if they're an overachiever, they're like, yay, but then their other classmates don't like them because they've ruined the curve. Whereas if you're kind of the median, you're always going to be getting a C even if you did okay. Like even if you got like 85% of the stuff right, you still might only get a C. So there's pros and cons to this. The usefulness of norm reference tests is that they're useful in selection of learners for advancement, but they do have limited ability to assess competency. A criterion reference test, this is much more what you're going to see in a clinical laboratory because it assesses mastery by achieving predetermined minimal competencies. Because in the clinical laboratory, we're training you to perform tests that affect people's lives, so we want to make sure that you're competent. So there are certain things that you have to have mastered. So the criteria for mastery are developed prior to the test administration, and it is possible for all learners to do well in our criterion reference test if they have achieved the minimal competencies. They are often used in pass-fail situations such as certification exams. You can also do kind of a hybrid of norm referenced and criterion referenced, where you have the minimum score that's needed to be considered a pass, but then you can also curve thereafter so that if it's like a particularly hard test, if you made an 85, you might have an A instead of a B. So you're still grading related to others, but there is a minimum competency that has to be reached. So you can do a hybrid format. All right, this is just a table to compare them side by side. It's for people who like to learn from tables. So the pitfalls of tests is that they assess lower level cognitive skills. So it's kind of hard to write test questions. So a lot of times it's easier to write test questions that test lower level skills like recall. So it's difficult to make questions that test higher cognitive levels. So a lot of times these focus on lower level skills. Sometimes in order to make an exam, quote, harder, instructors will assess irrelevant material or trivial information, which will promote the learners to just memorize facts, like all the facts, instead of what's actually essential for them to know. And then often the learning objectives will include higher cognitive domains and taxonomy levels, but that's not actually assessed in the exams. So the learners soon discover that the majority of the questions are at the recall level and then studied by memorizing facts. And then you can have grading can be subjective depending on the question type, like short answer or essay. And then poorly designed tests can occur, especially if you're rushing to make one or you're reusing an old test and didn't check to see if the questions are relevant to what you actually taught and when you taught them. So in order to assess higher cognitive skills, you want the learner to apply, analyze, and evaluate. So when you're writing a question, you want to ask, what do I expect the learner to do in order to select the correct response? So that could be things like a case study type question where they need to analyze what the diagnosis is, and then you might ask them something that once they have the diagnosis, what would the next step be? That kind of thing. So you can provide data and ask for analysis. So that can be things like performing calculations, correcting or recognizing a discrepancy, predicting results, outcomes, or effects, evaluate the reportability of results, or judge the appropriate action that should be done. And these are often kind of more difficult questions to write, but they're important to have in there. So another pitfall is that the instructor will assess material that's not in the objectives. So when you're designing a test, you should go through the objectives. I usually just have the objectives printed out and I go, okay, let me write a question for this objective. Maybe I'll write 2 or 3 questions for that objective depending on the size of the objective. And then I'll move on to the next objective and be like, okay, let me write a question for the next objective. So we're going to do a little example here. So for this one, the objective is right here. It says, discuss common interferences in creatinine assays. So that's what the learner was supposed to learn how to do. So which of these 2 questions best matches this objective? So the first question we have, serum creatinine is used to assess the function of the kidney. And then which of the following, and then the next question is, which of the following will result in an increase in serum creatinine values? So here we have hepatitis, diabetic ketoacidosis, myocardial infarction, metastatic bone disease. So which one actually looks at common interferences? This one is just, what is serum creatinine for? So that's not a great question. This is much more recall level. Whereas this one is actually asking you to figure out what would cause a false increase in serum creatinine levels not related to kidney disease, which I believe is myocardial infarction. And another complaint that learners have is that grading is subjective or vague. So there needs to be clear guidelines on what's acceptable versus unacceptable performance. And the criteria should be established in the learning objectives. So that's where in the ABCs of our learning objectives, the standards come in. And those need to be given to the learner so that they know how they're going to be assessed. And then the making grading rubrics can help reduce subjectivity when you're grading. They're often time consuming to create initially, but they do save a lot of time when you're actually grading, and they also reduce the subjectivity when grading. So this is an example of a grading rubric. So they have organization and they have different points for each thing. You see this person didn't get all the points for the introduction. And this one has, then over here they have the sum of the points, as well as a spot for the instructor to put written feedback. This written feedback portion, sometimes it's just at the end and it's just general. It's not divided by category, or it can be excluded altogether, though I do definitely recommend having written feedback. And you can see here, and you can also have more detailed rubrics where they have the scale of like what would get you 2 points, 3 points, 4 points, etc., and having clearly defined within each scale what that would look like. And we will be using grading rubrics I'll be using them when I'm grading your continuing education project, so you'll be able to see that. So then the next thing you do is design the test material. So they should be based on the objectives and cover all taxonomic levels. It's suggested for clinical laboratory science exams to have 50% at the recall level, 30% at the application level, and 20% at the analysis level. And in order to get this, you might need multiple testing platforms. You might need a written exam and a lab practical. And then you want to make sure that your exam is going to fit in the allotted time frame to ensure completion and reliability. One general rule of thumb with this is that each multiple choice question is going to take about a minute. And you should give 3 to 4 minutes for like a short answer type thing, even longer, like 10, 15 minutes for an essay. So you want to make sure that when you're looking at your test, does it fit in the time frame that you have to administer that test? If it doesn't, you need to cut it down. And then you want to allocate the number of test items devoted to each topic, because you don't want to focus heavily on one topic and then ignore the rest for the exam, because that's not fair, because they've spent time learning everything, and also it doesn't tell you whether they have learned everything. And then you want to create your test items. And then it's a good practice to group your test items together by multiple choice, by type. So you'll have all your multiple choice together. You'll have all your short answer together, because you don't want to have to be like, oh, multiple choice question. Okay, now I have to write an essay. Back to a multiple choice question. That's just annoying as a test when you're a test taker. All right, so the type of test items, we're going to talk about each one of these individually, but in general, objective items are things like multiple choice, true, false, matching, where there's one right answer. Whereas subjective items include things like short answer and essay, where there's a lot of wishy-washiness. I mean, the instructor knows what the right answer is, but what the student actually puts down might be like mostly correct or somewhat correct. And then how do you grade that? How do you assign points? So it's much more subjective. All right, so this is a table showing the advantages and disadvantages of the different item types. So multiple choice is easy to grade. You can sample a large amount of material. They're difficult to construct though, and they may test at a lower cognitive level. It's much more effort to make a multiple choice question that will test at a higher cognitive level. True, false, very easy to grade. You can sample a large amount of data. I don't necessarily agree that they're difficult to construct. They're difficult to construct in a way where it doesn't give away the answer, I'll say. The problem is, though, since there's only two answers, it does encourage guessing, because you have 50% chance of getting it right. And they usually test at a lower cognitive level. Matching is easy to construct. It's useful for testing specific facts. I know I really like using matching when I'm like checking if people have learned definitions, or matching analyte to disease kind of thing. And then it encourages memorization and tests at a lower cognitive level, but it's a really easy way to determine if they've learned like recall facts without wasting a bunch of questions on it. And then short answer, these are very easy to construct. So just like explain the role of creatinine in diagnosing kidney disease. Like super easy to write. And they can be used to test at a higher cognitive level. They can also stimulate creativity, communication, and organization skills. And since there is no right answer to choose from on the paper, you cannot guess. Not really. You have to put down something, whatever came from your brain. The problem is that they're extremely time consuming to grade. They're very prone to subjective grading because it's very rarely the Silver Merits word for word what you have on your answer key. And it has limited sampling ability because they do take longer to answer, so you can't have as many questions. All right, so we're going to talk about multiple choice test items. So a multiple choice item is made up of the stem, which is kind of the body of the question, and then the responses. So there should be obviously one correct answer, and then you have distractors. And the key thing with these distractors is they should be plausible. They should not be so far out in left field that no one is going to choose them, because then all you've done is made it, instead of being out of 4 answers, is now out of 3 answers, because no one's going to choose the 4th answer, hopefully, unless they're completely guessing. And the stem should be a direct question or an incomplete statement. The advantages are these are very easy to administer and grade. You can do a Scantron. You can very easily put them into a learning management system and have it grade it for you. And they can be designed to test higher cognitive levels, though that is difficult to design, to write them that way. It's much easier to write multiple choice questions at the recall level. So from an instructor standpoint, you kind of have to like put in more effort. They can provide a large sampling of objectives. The disadvantages are they're difficult to create. Honestly, it's difficult to come up with plausible distractors sometimes. It's possible to guess the right answer when you don't know what you're talking about, because you have a 1 in 4 or 1 in 5 chance of guessing right, especially if you've managed to rule out some of the distractors. And they tend to focus on the recall level. So we're going to talk about the guidelines to making a good multiple choice question. So first of all, the item should measure significant facts, not just trivia, because that's not useful for the learner. It doesn't assess competency. So on the left-hand side of the slide, we have an example of a poor multiple choice question where we have aging plasma requires incubation of citrated plasma at 37 degrees for, this is just a recall of a trivial fact about how long it takes to make aging plasma. If that's something they need to know, great, but it's not the best question. A better question for talking about aging plasma would be substitution studies using aged plasma are most useful for when they need to identify a single clotting factor deficiency. So this is more the usefulness of it rather than just how do you make it. The stem should represent the problem clearly and specifically, either in the form of a question or an incomplete statement. So one thing with writing multiple choice questions is you don't want it to be a question of whether the person can understand the question. You want it to be whether they know the answer and have mastered the objective, not their English reading skills. So over here we have an example of a poor question. This is not an incomplete statement or a question. This is just a word. This is hemoglobin A1C. And then you have all these various options. This is one of my pet peeves, is these single word questions, because it's not a question, it's just a word. A better example, this tests the exact same information, is that hemoglobin A1C can be measured in the clinical laboratory by titration, immunoassay, ELISA, and nephelometry. So these are both testing whether the student knows that hemoglobin A1C can be measured by immunoassay. The stem should be concise. So these two questions right here are the exact same question, except one has a lot of extraneous information, like the entire patient history of this guy, whereas this is just the relevant information needed to answer the question. So they should be concise, because you don't want to spend most of your 1 minute of allotted time just reading the question. So trim it down when possible. The stem should be stated in a positive tone. So sometimes that's not possible, but when possible, it should be done. So over here we have our poor example. So which of the following does not apply to DNA structure. It does not contain uracil. This has a double negative. That's annoying. It is a double-stranded helix. It's stabilized by hydrogen bonding. It's composed of ribose molecules. So when you have this not in here, if you don't underline it or bold it or all caps it or something, it's very easy for the learner to miss that and assume that they're trying to find something that does apply to the DNA structure. So it promotes the test taker misunderstanding the question. Whereas the better question is, this is testing the same information. Which of the following describes the structure of DNA? So this isn't a positive tone. So it's a double-stranded helix. So this one, instead of having A, B, it does not contain uracil. It's composed of uracil. So same type of question information is being tested, but now it's written in a positive tone. Another guideline is that the STEM should be qualified using of the following if a comparison is required. Because if you don't have the of the following, you might not have the very best option on there. That might not be one of the answer choices. So they might be like, oh, I don't know, like the best one isn't on there. So if you have of the following, it's kind of like, okay, out of the ones I've given you, which one is the best? So for this example, which of the following toxicology methods represents the most definitive confirmatory procedure? And the correct answer is GC mass spec. So the alternatives should be concise with any repetitive information placed in the STEM. So these questions are both kind of testing the same knowledge. So for this one, an adult male patient with glomerulonephritis had a creatinine clearance test performed. Which of the following results would be consistent with the diagnosis? So the problem with this is that it says a creatinine clearance of in every single test, in every single response, and that's just annoying to read. Whereas if you rephrase it, you now have creatinine clearance results over here in the STEM, and now you just have to put the answer choices, the values in there. So it's much more concise and easier for the learner to read it and choose the correct answer. You want to develop 4 to 5 responses for each item to decrease the opportunity for guessing. This might not be possible for some questions, because some questions, if it's like normal, decrease, increase, those are you might only have 3 options. You know, that's fine. But when possible, you should have 4 to 5 responses. And the STEM and response should agree in tense and grammar. So for this question over here, an antibody that reacts with an individual's own red cell antigens is called an. See, the problem is we have an and here. So I can automatically, as a test taker, rule out B because it's not going to agree grammatically. So that leaves me with A, C, or D. One way to get rid of, to deal with this is to put like A and then in parentheses and the N. So that way they don't know which one you're going for. A better way to phrase this is the term for an antibody that reacts with an individual's own red cells antigens is, and then any one of these options is going to work because it agrees grammatically. Now, if you had like an S, like any of these were pluralized, you would need like is and then in parentheses are to make sure that you're matching for tense and grammar, so that that doesn't give away the answer or rule out answer choices. So here's some other multiple choice guidelines. The words always, never, all, or none should be avoided because these terms are often associated with false statements and provide clues for the students. Because whenever you have those like very definitive terms in there, you're kind of like, well, it's not always that way. So therefore that must be wrong. So avoid those. And then any responses that have all of the above or none of the above should be used sparingly, if at all. And that's because if you're a test taker and you're looking at the answers and you see that all of the above is available as an option and you know that 2 are right, then you automatically know that all of the above is the right answer because you know at least 2 of the 4 are right. Whereas if none of the above is there and you see that at least 1 of them is right, then you know that none of the above is the wrong answer. So it kind of gives clues if you know a little bit of the information, but not all the information. The position of the correct responses should be randomized so that you're not having a ton of questions that where the answer choice is C or the answer choice is B. And then the responses should be placed one below the other instead of side by side so you don't accidentally miss reading one. And then the alternative should not be separated from the STEM by paging. So when you're designing a test and you're going through, you want to make sure before you like print it out that each question is on one page in its entirety, the stem and the responses. Because otherwise the student might think that there's only 3 options to choose from, and the right answer might be on another page. And the instructor should try to think like a student when designing plausible distractors and base the responses on student perceptions. So one thing I do, especially with like math questions, when there's an equation involved, I put in some extraneous information in there. Like you might only need 3 values to do the calculation, but I add in like 4 or 5 other values that could be plausible. And then I calculate it using those values that aren't relevant. Or I take the equation and plug things in the wrong place and use those as the answer choices so that the right answer is there, but the most likely way they were to mess up is also there. And then each test item should be independent of the other items. So you don't want a block of 5 questions where if you miss the first question, you're screwed for the next 4. And you also don't want to have the answer to a question in the stem of another question. When you're also more guidelines, I know there's a lot of guidelines for multiple choice. All responses should be expressed in the same unit, so don't change around units because that just clouds the issue. When the responses are number values, they should be arranged logically in increasing or decreasing order. So you don't want to jump around from like 50, 100, 25, you just want to be like 25, 50, 100. So that's logical because otherwise they might miss the right answer. And then for clarity, avoid double negatives between the stem and the responses. I was taking the university's like lab safety quiz, and whoever was writing the question had not learned how to write multiple choice questions because they had double negatives in there. And I was sitting here like staring at the question going, okay, which is the right? Are they asking me what it's? I'm like, I was just very confused. I was like, am I supposed to be choosing the right thing or the wrong thing to do right now? Because the double negatives was very confusing. And then when you're writing a question, you want to avoid a first or second person pronoun in the stem because it could make it difficult to identify one correct answer. So for example, using the phrase, what would you do in this situation, in the stem does not allow for a defensible correct answer because the learner could argue that any of the responses were correct because that's what they would do in a given situation, even if it's not the best practice. So you'd be like, in a given situation, what is the best practice to do in this situation? So you don't want to be like, what would you do? Because they could do anything. It might be wrong, but they could do it. More guidelines. And the responses should be of similar length, complexity, and format. So a lot of times you will see questions where the right answer is longer or has more qualifications than the incorrect distractors. So for example, if a poor question is the most common cause of iron deficiency anemia in adults is chronic loss of blood from GI tract as in bleeding ulcers. This one has like an entire sentence and the rest just have 2 words. So unless you're going to make them all long, you either have to make them all long or all short, because otherwise it clues in that A is the right answer. Whereas this is the exact same question rewritten, and instead of saying chronic blood loss from blah, 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 it now just says chronic blood loss. Still the right answer, but doesn't have all that extraneous information that clues people in it's the right answer. And then if the item is an opinion or guideline, the source should be identified in the stem. This is particularly relevant because it could be like according to CAP, according to the FDA, that kind of thing, because the guidelines might differ depending on what agency is publishing the guideline. So for this one, according to the FDA, polyspecific antiglobulin reagents must contain anti-IgG and anti-C3d. So it depends. You need to put in who's making that guideline. So that way it's not up for debate, because some would be like, well, I saw that this other agency wanted this, and that was one of the answer choices. Because then you've gotten into the problem of there's not one correct answer. Multiple choice items can be designed to have multiple answers. I like to call these multiple multiples. When this occurs, the following scheme can be used. So with this, you can actually make these, you can have these at the top and then have a block of questions, multiple questions that use that same scheme, which is nice. So for like A, B, C, D, and E, you have like A, false alternatives 1, 2, and 3 are correct. B is 1 and 3 are correct. C is 2 and 4. D is 4. And then E is all. So for this, the actual question is, in a family study, the mother is typed as group O and the father is typed as group B. Which of the following genotypes could their children have? So they could be BO or they could be OO because we don't know if that person has an O hanging out somewhere. So it's 1 in 3. Come over here. I see 1 in 3 is B. So correct answer is B. This can also help limit guessing, which is nice. All right, so now we've finished multiple choice questions. This is why one of the disadvantages says when it's difficult to construct, they're difficult to construct because there's a lot of guidelines on how to make a good multiple choice question. So some true false items. These are very fast to take because it's just read the question, go, okay, it's true. No, it's false. So it's very fast. Disadvantages is that it encourages guessing because there's only two answers. You have a 50% chance of getting it right. They're difficult to write in such a way where it doesn't where it doesn't clue the learner into what the right answer is. And these are used very rarely in CLS because there's very few absolutes in science. And these can often be reworked into a multiple choice item because really the only difference between a multiple choice item and a true false item is 2 more answers. All right, so if you are going to use a true false question, the statement should be as unambiguous as possible so it's clearly true or false. And given that, you should avoid the words always, never, all, or none, or only, because those are associated with false statements and then usually may and sometimes are associated with true statements, so they should be avoided. So that's why it's kind of hard to write because you don't want to, it's hard to write a good true false question that doesn't have those words that clue people in about whether it's true or false. And then to minimize the potential for guessing, you can make it harder by having the student correct false statements to make them correct. So I had a microbiology professor coworker at my last university who would do that. So matching test items, these are useful for testing large amounts of information. They're useful for correlating data and they're easy to create. The disadvantage, they promote memorization. I mean, sometimes you just need to test if they've memorized something. So matching test items are the best way to do that. So like I use that for definitions. Other times you need them to actually do some analysis and matching test questions are not great for that. So when you're writing a matching item, you want to clearly state in the directions whether or not the responses can be used more than once. That's important. Otherwise, as the instructor, you're going to have students coming up to you asking if they can use responses more than once and where the responses should be placed. And you want to arrange the columns in a logical order, for example, alphabetically or numerically. And then you want to include several extra responses to minimize guessing. So if you have 4 items that you're matching to, you want to have like more than 4 options to choose from. So I like to have at least 1 more, possibly 2 or 3 more. And then you want to keep the test short and concise and keep the matching items all on the same page. This ties back to the multiple choice thing where you want the entire question to be on one page so the student doesn't mess up because they didn't see all the options. All right, so now we're going to talk about our subjective items, which are short answer and essay questions. So these are very easy to make because you don't have to come up with distractors. You don't have to come up with plausible responses. It's just easy. And they're useful for assessing higher cognitive skills because this is where you could get the explain this, discuss that, advocate for this type things that are in your learning objectives that you can't really do with multiple choice questions. The disadvantages are that these are very difficult and time consuming to grade. You get a limited sampling of the objectives because there's just not enough time on an exam to answer a bunch of short answer and essay questions, so you can't ask that much information. And it's very prone to subjective grading because no one puts down the very perfect response. All right, so you want to place the points assigned to each question on the examination so that the student knows, okay, this question's worth 20 points of my exam. I should make sure I do super awesome on it. Whereas if it's only worth 2 points, I'm probably not going to dedicate a whole bunch of time to it. So let them know how many points it's worth so they can dedicate their time accordingly. You want to set a reasonable time limit so they have enough time to answer it, and they're not rushed to do it. And one thing that's been shown to lower test reliability is allowing students to choose the item. So if you have multiple essay questions and letting them pick 1 out of 3, that has to do with lower test reliability because the student's going to choose the one they're most comfortable with. They might not have any idea on the other 2. So it doesn't actually do a good job of showing competency. And then tests composed of short answer items should be designed to include an appropriate balance of lower and higher cognitive level questions, because a test that's completely made out of higher cognitive levels is just mentally exhausting to do, and it's not showing if they've learned the facts. And the objectives also have lower level cognitive questions or areas, so you want to make sure you have a nice spread. All right. So in order to evaluate essay and short answer items with the least amount of subjectivity, it's best practice to develop a grading rubric with the answers and criteria for each question prior to grading the test, and then assign points for each criteria. And then you want to read all the student answers to one question at a time. So you get all their tests out, you read all of question 1 for every student, and kind of see what the responses are looking like. And you might need to adjust your grading rubric at that point, because they might have put things that you're like, oh yeah, that is right, I didn't put that on my rubric, let me include it, that kind of stuff. Or you might want to decide how to take off points for a common error that's happening that you hadn't accounted for. And then you want to, in the perfect world, you want to grade the test without knowing the student's identity. And furthermore, if possible, you want to have the test evaluated by another instructor to see how they would grade, because then you're having subjective grading from 2 people, which will hopefully be cumulatively more objective. All right, so now we've talked about the different test items. Now we're going to talk about how you can analyze the tests and the items to see how they're performing. Are they actually doing a good job of testing what you think they're testing? So test item analysis is used to determine the effectiveness of the items. So there's 2 different types. You can analyze the test itself, which would be looking at like distribution of grades, like the standard deviations, the measures of central tendency. So that would be like, okay, what was the mean on this test? Was it a 65? That's not great. Was it an 85? Yay. So that kind of thing. You can also look at the individual items in determining what was the pass rate for a particular question, the distribution of responses. This information is often computer generated. So when you have like a Scantron test or test that's done online, you get those statistics as part of your grade report. So the item pass rate is also called the difficulty index. This is the percentage of test takers selecting the correct answer on a particular item. So it's calculated by the number of learners with the correct answer over the total number of learners. And in general, it should be about 40 to 95%. You might design it so that you have 100% if it's a critical competency like ABO typing. You want everyone to get that 100% of the time. And then a low pass rate might indicate that there's a problem with the item construction, like it's a bad question. The answer key is incorrect. That has definitely happened to me a couple times. And you're like, why is everyone getting this wrong? Look at the answer key. Oh, that's why. I keyed it wrong. And then, or it's not covered by an objective, so no one studied it because they didn't think they had to, so they didn't learn it. And then an item, you might want to put items that have a higher pass rate historically at the beginning of the exam, because that helps build the confidence of the learner as they're taking the test. Because if all the hard questions are at the beginning, and they're like, oh my gosh, I don't know any of this, they're going to start getting freaked out, and then they might not perform as well as they could because they're freaked out about how hard the first questions were. So the discrimination index, this ranges from a +1 to a -1. And it indicates how well the item discriminates between good and poor performers. So you want a test question where the people who get it right are the people who perform well on the test, and the people who get it wrong are the people who perform poor on the test. So a negative number means that more poor performers got the item correct than good performers. So this basically means that the poor performers are just guessing, and I guess guessing well. Whereas a good test item should be able to discriminate between learners. So an ideal discrimination index is greater than 0.4, and this is values usually calculated by a computer, but you want test items where the learners who performed well on the test got it right, because that's discriminating between good and bad performers. So there is a relationship between the discrimination index and the difficulty index. They're very closely related. So the maximum discrimination index of 1 is only possible when the pass rate is at 50%. So if the discrimination index were 1, all the learners who performed the best on the examination chose the correct answer, and none of the learners who performed poorly on the examination chose the correct answer. So if most learners correctly answer an item, i.e. has a high pass rate, or if most learners incorrectly answer an item, low pass rate, the item will have a poor index of discrimination. So you have to look at both values to determine if it's a good or a bad item on the test. And we're going to do some examples. So this is a question where we have our responses. The asterisk indicates it's the right answer. So 17 of our students thought D was the right answer. And then we have a 3 and a 5, and no one chose B. Our pass rate is 0.68, which is in our criteria for acceptability, and our discrimination index is 0.3. So from a statistical point of view, this is a good item. The pass rate of 68% indicates that the learners selected the correct answer, and the discrimination index indicates learners who performed well on the exam overall selected the correct answer more often than learners who performed poorly on the examination. But it's also noteworthy that no one chose B. So B is probably not a plausible distractor and should be rewritten. All right, so our next item, we have our correct answer is B. 8 people chose it, and then it's kind of a semi-equal spread of the other answers. Our pass rate is 0.32, which is not wonderful, but it's not horrible. And our discrimination index is really close to 0. So this is a difficult item because only 32% of the learners chose the right answer, but sometimes that might be appropriate for the test. So the discrimination index is where you come in to determine whether it's a good test question or not. So our discrimination index is 0.05. So this is showing that this test question is not discriminating between good and bad learners. So the test item might be poorly written, it might be material the learners haven't studied, or it might be testing trivial material, like that they didn't memorize. So, and then the spread of responses where you just kind of have everyone, kind of an equal number of people choosing each answer, shows that mostly people are just kind of guessing, or there's not really a good reason why they're choosing one or the other. So it's not a great question, and it should be rewritten or thrown out. All right, so now we're going to look at this one. Our correct answer is 8. We see that a lot of people chose C, and then some people chose B and D. Our pass rate is the same as that item 2 question, but our discrimination index is 0.48. So this is also a difficult item because our pass rate is only 0.32. However, the discrimination index is way better than the discrimination index in the last question. So this does a much better job of where the learners who performed well got the answer right and the learners who performed poorly got the answer wrong. So this shows why we need to look at both the pass rate and the discrimination index, because this question is probably testing at a higher cognitive level and doesn't really need to be rewritten. It's doing what it should be. Whereas the other one, something's wrong with it and needs to be looked at. So test reliability, this is related to the consistency of the test scores, like the overall test scores, not just the items. So this is reported as a correlation coefficient. So for a classroom exam that's written by just your random instructor, the correlation coefficient is between 60 and 80%. Whereas a standardized exam like the Board of Certification has a correlation coefficient greater than 90% because these are very rigorously tested. When you take the BOC, there will be practice questions on there. You won't know that they're practice questions, but they're questions that don't contribute to their score, that they're seeing if they are good questions to include in subsequent BOCs. So these are affected by the quality of the items, the number of items. So the more questions you have in a test, the better the reliability gets. Then you have the objectivity of the grading. And then you also have the student's physical and emotional state. So if you're taking it while you're fighting the stomach bug, or you just broke up with your boyfriend, you're not going to be performing as well as if you were in a good mental and physical headspace. So test validity is how well a test measures what it was designed to measure. So there's two types of validity. There's content validity, which is the extent to which the test is related to and samples the intended content or domain of the task. So this is not really measured statistically. Basically, you look at the objectives, the course content, and then what test questions were given and kind of go, okay, is there a good match between them? And then you have criterion validity, which is the extent to which the examination predicts some specific outcome. So this can be, if you take your practice board of certification exam, how well does that predict your success on the actual board of certification exam? All right, so evaluating your test effectiveness. Was the test relevant and balanced? Was the test of an appropriate length? You don't want it to be too long. You don't want it to be too short. I know I always kind of get, the students always freak out when they find out how long my quizzes are, because my quizzes are about 25 questions. They're like, why is it so long? It's like an exam. I'm like, but it improves the test validity and reliability. And also, if you don't know something, it's not going to completely bomb your score. Was the grading objective? Did the test discriminate between high and low achieving learners? Was the test difficult enough to be challenging but not unfair? Because trust me, students do not like it if your test is way too hard. And was the test reliable, and was the test valid? All right, so we've talked about learning assessment. Now we're going to talk about performance assessment. This is done kind of during lab practicals as well as when you're actually working as a clinical laboratory scientist. So written tests, the advantages to these are that they measure cognitive skills, and they require less supervisor and instructor time because you sit someone down with a piece of paper and go, hey, take this test, and it's easy. Disadvantages is that it only measures cognitive skills. So a well-constructed test can measure higher level cognitive skills such as analysis, synthesis, and evaluation, but when you're actually working in the clinical laboratory, you do need to have some psychomotor and attitude testing as well. So one way to do this is direct observation. This direct observation must be documented. So some tools of direct observation include anecdotal records, rating scales, and checklists, and we'll talk about each of these. All right, so anecdotal records. The benefit of these is that it's very useful for evaluating effective domain objectives, like attitudes and things like that. And you can provide good feedback. The problem is they're time consuming to write up. And it's usually, you need to be most effective, they need to have multiple people writing up things. And they're also prone to having only the highs and the lows recorded. So you only write down the things that stood out the most. So like unusually bad behavior or unusually good behavior, and it has a tendency to omit just the ordinary acceptable behavior of you're doing a good job. And then having multiple evaluators improves the validity of anecdotal records. You can also have rating scales. There's different types of rating scales. So the one below is an example where each trait is defined and then description guides the instructor's rating. So for this one, the trait is the ability to work under pressure, and they would check one of these options. So cannot perform under pressure, completely stops works, versus may get nervous but continue to do accurate work at a normal pace. So the instructor could show where they go, and this helps get rid of some of the errors of contrast problems, where if someone's particularly efficient, they may think or handle stress really well. Any student who doesn't perform to their very high standards can get a lower rating. So then you also have rating scales that are with less detail. So where you just kind of give, okay, a 1 is poor, and then a 5 is outstanding, or a not observed. It's very important to have a not observed on there because you don't want them to have to guess if they never saw it. So preparation for daily assignments. So you could put a average, but this has a problem with comparison. And we'll talk about some of the problems with this type of rating scale on the next slides. So some advantages, you can use these to evaluate the effective domain. They take up less time than the anecdotal records. So the first type of rating scale I showed you that had the individual traits listed out, those take more time to fill out, but they're less subjective. Whereas the rating scale with the numbers, those are faster to fill out, but there is more subjectivity in them. And they become more objective when the traits are defined. So the disadvantages of rating scales is that there are some errors associated with rating scales. Error of leniency, central tendency, the halo effect, contrast error, and proximity error. And we'll see the definitions of these on the next slide. So error of leniency, this occurs when the evaluator rates a learner, an individual, higher than they should be, this is usually because like the evaluator knows and likes the student or the practitioner. So it's like, oh, Anne is fantastic and I just love her. We're best friends. And then you would rate them higher. Whereas the error central tendencies is some evaluators don't really want to give like all 5s or all 1s, and they just kind of go, okay, I'm just going to kind of hover around the 3 and 4 range and just give everyone an average. Or this is especially true if the instructor hasn't had time to observe the individual's behavior. So this happens a lot with like supervisors where they're, doing their supervisor thing, but they're not in there in the lab watching someone all the time. So they're kind of like, I'm just guessing, so I'm just going to pick the middle. And then you have the halo effect, and this halo can be for good or bad. All right, you can have a good halo on you or you can have a bad halo on you. So depending on how the evaluator sees you, they have a general impression of the individual, and this impression influences the judgment of all of that individual's traits. So say, for example, there's an employee who just you don't mesh with and you are not friends with them, and like they don't do anything wrong in their job, you just don't like them, you're going to have a tendency to rate them lower than someone who you have a good impression of, even if they're both performing the same. And then you have the contrast error, where this error occurs when the evaluator contrasts the trait in themselves and in the student or practitioner. So this happens when like the evaluator thinks, wow, I'm super efficient, and this person is just not super efficient. And they might be perfectly fine, but they would have a tendency to rate them lower on efficiency because they're not as good as the instructor is. And then you have proximity error, where depending on where the trait is on the evaluation form, traits that are next to each other have a tendency to be scored in a similar fashion, even if they're not related. So another direct observation type is checklists. So this is kind of an all or none format. This is extremely helpful for assessing psychomotor skills. So we use these when we're seeing if you can do phlebotomy. We have a checklist of, did you use alcohol? Did you tie the tourniquet? Did you identify your patient? And it's best if these are listed in order that you would expect them to be done. So for the ABO slide typing, you check the labels on the patient sample. Then you add your reagents. Then you add your cells. Then you mix and tilt, and then read reactions and record interpretation. So it's best if these are in the order that they're actually going to be performed. And you want to include only critical items to keep the form short enough to be usable. And the checklist should be written in specific behavioral terms and arranged in the natural sequence of the performance to help the observer, because if the observer is busy trying to find where the item is on the checklist, they're not paying attention to what the practitioner is doing. All right, so ways to evaluate performance. You can evaluate their work, which is through practical exams. The problem with practical exams is it's a controlled testing environment, so that's good in some ways, but it's also bad because if someone knows that they're in a practical exam, that can make them very nervous, so they might make mistakes that they would ordinarily avoid, or on the other hand, since they know it's a practical, they might be more careful than they normally would and repeat testing when they normally wouldn't. So one thing you can do is actually do a review of results and records and see what that particular student or employee has produced over an extended period of time. And that can be helpful in detecting if certain behaviors have improved over time as they become more comfortable, or see behaviors that have not improved and whether they need work. So for competency testing, a supervisor may wish to monitor a practitioner's test results in reporting to assess compliance with laboratory procedures, and then evaluate the individual's ability to detect and resolve problems. So a review of records is a good way to kind of see how they're actually performing in a real life situation, whereas a practical exam is a better way to see what they're doing in a controlled situation. All right, so another way to evaluate performance is a peer observation or self-assessment. So a peer observation where you have your peer, so that would be like another classmate or another employee, completes the checklist or rating scales. And it's best if this information is used in like a formative evaluation, like where formative is just a part of it. It's not like the end all be all of your evaluation. You can also have the student or employee do a self-assessment by completing the rating scales. This is helpful for developing self-assessment skills because it's good to know where you're at. Where do you think you're at? Are you good at assessing your own skills? So the instructor or supervisor can look at the rating scales and be like, I see that you've rated yourself really bad in this category. You're actually better than this. Or it can be like, okay, you're rating yourself as perfect. Let me tell you, you have room for improvement. So it can help students develop self-assessment. And this is also best for formative evaluation, because if you know this is going to like severely affect your grade or your employment status, you might have a tendency to overestimate your skills. So this should just be, more for learning abilities rather than, an actual big portion of your grade or employment. So another way is matching the domains of the objectives. So we're going to match our domains and our objectives and determine which type of assessment is good at assessing different types of objectives. So this is a little game. All right, so we have written tests. So do we think those are cognitive, psychomotor, or affective? I'm going to go cognitive. Practical exams, cognitive, psychomotor, or affective? Both cognitive and psychomotor, because you got to have some cognitive stuff in there, but you definitively have psychomotor. And then checklists, these are good for psychomotor. Review of records are good for cognitive and psychomotor. And then rating scales are good for affective or psychomotor, and or depending on like what's in the rating scale, you can use it for psychomotor or affective or both, depending on what's in there. All right, so another way to evaluate performance is the competency assessment. And the competency assessment assesses individuals. So this is not a personnel evaluation. So a personnel evaluation goes a little bit further and covers more things, whereas a competency assessment looks at the personnel's ability to use knowledge, skills, and experience to correctly perform tests. So this is more a psychomotor evaluation of an employee or student's ability to perform a task. So a personnel evaluation covers all aspects like customer service, professionalism, that type of thing. And then proficiency testing, which hopefully you learned about in your management class, assesses the laboratory's ability to provide accurate results. All right, so performance evaluations, your competency assessment is your individual performance. Your personnel evaluation includes the competency assessment, but also covers customer service, dependability, professionalism, teamwork, things like that. Proficiency testing is a method of verifying the accuracy and reliability of the laboratory's test results. That's been performed by the entire laboratory staff. And managers may look at a individual's proficiency testing results to see if they're doing a good job compared to what the proficiency testing should be, but it's not necessarily, it's a part of their competency assessment. All right, so it's important to do competency assessments because it is required by the CLIA 88 rules. So 6 methods can be used, and it needs to be completed annually for all employees and semi-annually if the employee is new. So, and anytime the lab introduces a new test method or instrument, you need to reassess the competency of the employee on that test method and instrument before they're allowed to report patient results. Otherwise, when CAP comes in and does a review of things, they'd be like, oh, you have these people reporting results on something you haven't even shown they're competent on. You are in big trouble. So everyone has to be considered competent before they're allowed to do something new. All right, so our 6 competency testing procedures that are required by CLIA 88. We have one is the direct observation of patient test performance, and that can be done by checklists. You can do a review of records and test reporting. That's obviously done by a review of records. And then 3, a review of intermediate test results, QC, PT, and preventative maintenance records. So that would also be review of records. Direct observation of performance and of instrument maintenance and function checks. So that would be a checklist that you would do. You could you directly observe them doing it and go through a checklist and make sure they're doing everything they should be. 5 is testing of unknowns or external proficiency testing samples. So this would be like a practical exam, a review of records, or having an individual do a proficiency test sample. And then you have assessment of problem-solving skills. So this would be practical exams or written exams. You could also do direct observation as well. All right, so when you're evaluating performance, one thing that's often required of instructors is giving feedback, or managers is giving feedback. So you should base your comments on the goals and objectives. So a lot of times instructors or trainers may be unwilling to write negative comments because they're concerned about the consequence of their comments, because like, oh, so-and-so is really nice and I don't want to write this bad thing about their competency, or I don't want them to try to sue me. So you want to make sure that you give feedback. But one thing about that is, in terms of like writing negative comments, if it's relevant to their job or their performance, you cannot be sued for it, like depending on how you write it. So we're going to talk about how to write good feedback. So you want to make sure you give feedback in a timely manner. One, because that helps provide opportunity to correct problems. There's nothing worse than doing 3 weeks of rotation and then finding out that from week 1 you were not meeting expectations and you made a bad grade. You're like, you could have told me in week 1 and I could have corrected the problem. And then you want to have time to reinforce good performance. You need to be specific in your feedback. So just writing great job is not super helpful. You want to separate the behavior from interpretations. So one example of this is an example of poor feedback. So this is about a student. This is the worst student I have ever taught. She is unsafe in the clinical laboratory. That's a little rude. Whereas a better description would be, after 4 days of instruction on the urinalysis bench, the student was unable to perform the microscopic examination of urine samples. The student could not identify white blood cells, red blood cells, or bacteria. She was not able to discuss the correlation of the chemical results with the microscopic findings in the samples. So you're just giving a rote, this is the behavior I saw. And then you can add an interpretation. This individual is performing well below the expectation of students who have had 4 days of instruction in urinalysis. So you don't want to just be like, this is the worst person ever. You want to give specific examples and separate the behavior from the interpretation. And then you want to start with positive feedback before giving constructive comments. Because if you start out with like mean things, they might just like, no one likes to hear bad things about themselves, so they might check out and not pay attention to the rest, where you actually start telling them good stuff. And then you want to verify that the feedback that you've given is understood and hopefully internalized. All right, so we're going to look at some feedback that's been given. So Clara is a new employee in the blood bank at St. Agnes Hospital. You are her supervisor. 6 months into her job, Clara scores a 60% on a competency test. And in direct observation of Clara's work, mistakes in routine typing and recording are noted. Everyone in the blood bank likes Clara. Well, it's wonderful that everyone likes Clara, but she's not doing her job right. So you write the following comment on Clara's evaluation. You work well with others, but you need to do better on competency tests and on the bench. So what do we think of this evaluation? I think it's nice that we started with a positive, but the you need to do better, that's kind of vague. I feel like it should be like, you have mistakes on routine typing and recording. This needs to be improved. Like, you need to have a little bit more about what's actually going wrong and how to improve it. Because does she know particularly what she's doing bad on the competency tests and on the bench? So it can improve. So now we're going to talk about Clark, who's also at St. Agnes, and he's a student in the MLS program, and he's been late to the micro lab about half the time. Clark took the first exam and got an A. Yay, Clark. He has had one practical and identified all organisms correctly. When Clark has to handle more than one thing in the lab, he gets flustered and makes mistakes. The education coordinator gives Clark his grade on the practical. She makes note of Clark's tardiness problem and his mistakes in his file. She plans to give this information to Clark as part of his final evaluation. What do you think of this evaluation? So one problem with this is that the evaluation is not timely. He's not being told about these problems until he's already done with his evaluation. It would be best to talk to him about his tardiness problems early on, and also to talk to him about how he gets flustered and makes mistakes, and maybe work with him on how he can work on that before the end of the rotation, so that way he has time to improve on those things and hopefully raise his grade and improve his skills, because that's ultimately what rotations are for, is to improve skills. All right, so Claudia, also another MLS student, is finishing her hematology rotation, and she's received the highest score of any St. Agnes student on the exams. Way to go, Claudia. Claudia also had high scores on the bench evaluation form, so she's good both cognitively and psychomotor. The hematology lab was impressed with her technical and interpersonal skills and hopes to hire her when she graduates. So not only is she competent, they also like her. So Claudia received her evaluation in hematology. Grade A. Comments, you did a great job. So what do we think of this evaluation? It's great that they think she did a great job, but this is super vague. This is like, this doesn't tell her anything. It doesn't tell her that they loved her or that she was amazing and awesome and that she's the best they've ever had. They could be way more specific in their feedback, especially if they want to hire her. As a clinical education coordinator in the past, I've read a lot of feedback from instructors, and it's great to see when the evaluators want to hire the students or they think they did a fantastic job and why it was fantastic. If it's, oh, you did a great job, it's like, okay, well, why was it great? What did they do? So more details is definitely needed in this feedback. And then our last slide is a summary. So learning and performance assessments are important for students and employees. And then there are several types of assessments that are suitable for different situations, such as a cognitive objectives being assessed by written means, psychomotors are good, practicals, direct observation and review of records are good for assessing psychomotors. And then you can also do direct observation, review of records, and anecdotal for the affective domain.